It's day 2 of the fire camp, and I've broken out into a side room and I'm sitting here with Ewout Kramer, who is, of course, the COO of FHIR. So, Ewout, today what did you discover that was interesting for you? What interested you in today's fire camp?
What is always interesting to me is it was nice to recap the history of fire, of course, but what is even more interesting, and that is of course when I sit up in my chair and listen, is what is everyone seeing as the major roadblocks in the future of fire.
Sure.
So that was one of the subjects that I really enjoyed, and I was happy to discover that more people are worried about when will the patient come in, right? What is also interesting, I thought today, well, I had this discussion on how can we use AI in fire? And it's, of course, a subject that everyone's wondering about, and you can see the diverse list that we came up with. And there are some truly cool applications there. And it goes from like almost possible to completely impossible from left to right. But it's really interesting for me to see how people that are in this conference, how they are looking into how they're going to apply AI to fire. So that was another subject that I really liked.
Yeah. I thought what was super interesting about this morning's discussion with the history of fire and your role there was that there was a little bit of nostalgia for the old days where it was like a tight operation, people sitting in a room or on a video call trying to hack together specs with this idea and that enthusiasm.
Yeah.
Do you think that like events like Fire Camp are important to kind of try and recapture that or recreate that?
So I think that if you ask any big company, like what was the most fun period to its founders, they will say, oh gosh, the first few years and we're hacking away and our first customers. And so I think for the main core fire specification, those days aren't coming back. But that doesn't mean that we can't have the same thing for all these new domains and like substandards that we're writing for the fire standard. Josh Mandel did the same thing for SMART, right? SMART on fire was something that was developed almost independently of fire, and so was SQL on fire.
Yeah.
And so for these things, you can definitely bring that startup-y feeling back. And when I sat in on the SQL or the SQL on fire discussions, I did feel a lot like the old vibes coming back, like discussing late evenings and whiteboards and so on. Yeah, so for sure.
Yeah. It's a bit of a chance for a plug here, but are we seeing a convergence on the Fire implementer tool set and what tools are indispensable?
I don't think so yet, to be perfectly honest. I think there are some established names like the Sushi tool stack and the IG tools from Graham, and of course we see quite a bit of usage in our own simplifier tools.
Yeah, and Forge, of course.
And Forge, but I don't think that as a community we are at the maturity level yet. I mean, for us, for the early adopters, those tools are fine, but I don't think they're good enough for the loads of people that come after us. So I don't think we're there yet, to be perfectly honest.
So this touches back to what we were talking about before. What do you think is the role of AI in the health, the future of digital health?
So not specifically fire, but digital health. I still would say that AI is going to be great help to doctors and patients alike to help with diagnostics and treatment plans and everything and so on. Right? I'm looking forward to, like, if you as a chronic patient, you put in all your information, you keep a lot of data about your disease, and then AI may predict the amount of asthma medication that you would need for the next day based on the weather today and your history. Those kind of things, that a real difference, I think. And we've seen the stories of people who were not content with their doctor's diagnosis of some rare disease that their children have. They put in everything they knew, and they know way more than the doctors about their child's disease. And then an AI comes up with a totally different diagnostic. I don't know if you heard that story of that. I spoke to the guy not that long ago. And he found another diagnostic, and then came back to his doctor, and his doctor said, "Yeah, that might be it." And they researched it, and it was actually a different diagnosis. So that is going to make a big difference.
Yeah. And finally, what developments are you excited for in Fire in 2025?
The near distance. Personally, let's see. That's a good question. For next year, I am looking forward to, I know that we are, and Health Samurai is, and Smart Guys, everyone's working on proving that our fire service can be performant
Right.
Right? Because as FHIR is maturing now, you can see that the customers that are using our products, they are growing too. We're not anymore like in these demo Mickey Mouse use cases that with 100 patients or so. No, right? Real use cases
Right.
going into production right now, real production stuff that makes FHIR essential, right? FHIR won't go away if we have the stuff in production.
Right.
And it is up to the tools developers like our companies to improve our tools to such an extent that they can like support these kind of workloads
Right.
that are coming up. So that's I think what I'm looking forward to in the near
Okay.
term.
So you're talking about scale there.
Scale.
Right on.
Yeah.
Okay. Thank you so much.